Careblazer, there are approximately 7,600 board certified geriatricians in the United States at this time. There are approximately 250 board certified geropsychologists in the country right now. That's what I am, a board certified geropsychologist. So we got 7,600 geriatricians who are board certified, and we have about approximately 250 geropsychologists who are board certified. Now, we currently have approximately 6 million older adults in the United States who have dementia. Anybody see a problem with that? That's quite a big gap between experts in a certain field of geriatrics and older adults who have dementia. And the number of older adults who have dementia is just growing. And this number of top geriatric experts, it is not growing exponentially. In fact, I could do a whole nother video on why geriatrics is not a field a lot of healthcare providers do not want to go in. But this is a big concern and this is a big issue. And so this is the last video in the month of April where I am talking about controversial and unpopular opinions. And this is going to be a hard one for me to do. And I just want to apologize in advance. I don't want to offend anybody at all, but this is truly a channel to help dementia caregivers. And so that's what I'm here to do. Even if it means I'm offending people in my own profession or in the healthcare field, or even some of my own dear friends, I don't mean to. I just want to give caregivers something to think about. The chances that you or your loved one are seeing a healthcare provider with zero to little training in geriatrics is high. I do want to qualify, just because somebody isn't board certified in geriatrics or geropsychology, it doesn't mean they don't know anything about geriatrics. There are some people who have quite good knowledge about geriatrics, but maybe for some reason they just didn't go through board certification. It doesn't mean other providers don't have good knowledge. However, the majority of providers do not have great knowledge on dementia care. So the chances that your loved one is being seen by a provider without a lot of great knowledge on dementia care is pretty high. In fact, many providers get their training on dementia care just from all of a sudden the people coming into their office now seem to have dementia. So if you've ever been given the advice or you've ever heard, oh, your loved one has dementia, there's nothing we can do, and maybe they're given a prescription for something and turn in 6 months to a year, that is what we are seeing happen. I hear stories like that all the time, and quite frankly, it's not the truth. And so the big message here is, just because somebody has a fancy title or fancy initials behind their name, it doesn't mean they know more than you. It doesn't mean they know more about dementia than you. It certainly doesn't mean they care more about your loved one or know more about your loved one than you. So I want to give all of you permission to advocate for your loved one. If your loved one's doctor says something and you're not clear about it or you're not sure what it means, it is okay to say, I don't understand this recommendation. Can you tell me more? Or I don't understand exactly what you're saying there. Can you say it in a different way? Or why are you recommending this and not this? Or I have heard X is helpful. Would that be helpful in my loved one's position? Why or why not? It is so uncomfortable, I know, to be in a position where maybe you advocate in the doctor's office. I know some of you are totally fine with it and you guys are so great, but for a lot of you, I know it can be uncomfortable. Heck, I'm uncomfortable just kind of advocating for my own healthcare whenever I'm in a healthcare appointment, because it's very clear that it's like it is a time limit and there's a lot of patients waiting and kind of hard to speak up sometimes. I want to give you all that permission to do so, and also let you know that much of the healthcare field, quite frankly, isn't very good at helping people with dementia and don't know all of the things that can be helpful. And while it is true, we cannot reverse this dementia or cure it or take it away, I believe there is a lot that can be done. I believe we can do a lot to improve the quality of life of the person with dementia, the quality of life of you, the Careblazer, and improve their overall adaptability and functioning in their day-to-day life. And so if they aren't focusing on any of that, you can ask them for a referral to somebody who will. You can ask them for equipment, resources, other professionals that might be able to help improve the quality of life for your loved one or for yourself, and that is totally okay. Full disclosure, Careblazers, I do have a high-level personalized program called the Care Course where I work exclusively with Care Course members on answering their questions and helping them through the most difficult caregiving situations. I also have a free online support group of types where caregivers come together from all over the world and they ask each other questions and they get feedback. So just putting that disclosure out there as I'm talking about these things right now. So I'm going to say another controversial opinion that, okay, yes, I will say it. I'll say that here in just a minute. But for this first part, it's that you care for your loved one more than anybody else. No matter, even if you're seeing the most big-hearted, kind healthcare professional possible, they're seeing a dozen patients a day, sometimes even 20 patients a day. There's just no way for them to know as much about your loved one as you do. And so it's okay to push. It's okay to ask questions. It's okay to ask follow-up. It's okay to ask why. And I don't think, especially in the field of dementia care, we should just be taking things blindly because the person has doctor in front of their name. Okay, sorry for all my healthcare professionals out there who might see this video. Now I want to apologize to some of my most amazing, wonderful people in the dementia care field who are doing great things online for raising awareness with dementia care. My other thing I want to say, not a popular opinion at all, is that good intention is not enough. Having good intentions is not enough. And what I am noticing in the online world is that more and more population is aging in general. The population of people with dementia is getting bigger and bigger. And there's a group of people who see an opportunity. They see an opportunity of, here is a need, here's a group of people who aren't getting all of their needs fulfilled, and so I'm somebody who could possibly fulfill their need. And so what they do is maybe they've had a personal caregiving experience, or maybe they've had like a job for a couple of months or even a couple of years where they worked in a place where people with dementia were there, but they didn't really have a true provider-patient relationship. They were just kind of around. And I'm seeing people take that and now go and try to offer programs to caregivers to help them. It doesn't mean they can't be helpful. I want to be very clear about that. They could probably be really great at starting a support group. They could probably be really great at sharing stories and just being a great, lovely person. But I don't think good intentions are enough. I'm getting a little nervous at people who, because maybe they took a weekend class and they got a piece of paper that shows they're like a certified practitioner of some sort, like that is not enough. If you are going to help people with dementia and help the caregivers take care of them from a place of being an expert and from a place of saying you understand the disease and you know how it presents, I think that you have to have the scholarly inquiry, the evidence-based practice, the access to research articles, the ongoing continuing education to stay up to date in this field that is rapidly changing. I don't think good intentions and good heart is enough to say that you're an expert and you're certified to help all these people. I just probably lost a lot of people, didn't I? Like, somebody can have the best intentions in the world to help somebody, but without the professional background of it, it can be quite dangerous. It might not be such a great idea. And for caregivers who are so desperately looking for any help possible, it's so easy to just turn to somebody and to hear somebody say, well, I'm an expert, or I offer this program, or I do something, and then to just go forward with it. But I think it's important to be okay asking questions. What is their training? What is their background? How do they stay up to date on their research? It's okay to question. Here's the big message of it all. Do not discount what you know about your loved one and what you've learned about the disease yourself with your loved one. Don't discount all of that because somebody across the desk or somebody else who has a fancy title tells you otherwise, tells you that won't work or there's nothing that can be done. Don't fall for that. And something else that might be a little bit unpopular in my healthcare community is something you could do as a tip is you could consider joining a support group or an online forum, and you can ask questions to those caregivers and say, has anybody had success in this, or has anybody tried this? And you can see what other caregivers are saying. That is not a replacement for healthcare, but you can at least take that information and you can bring it to your healthcare provider and you can say, hey, I've been hearing information that blank might be helpful for dementia. What are your thoughts? Hey, I've been hearing information that cannabis is something that might be able to help with anxiety. What are your thoughts about that? And when they say, oh no, definitely that won't work, you can say, well, can you tell me why? Can you give me some of the information or resources that explain why that's dangerous for my loved one or how that won't be helpful? You can even ask if they do recommend a medication, can you tell me how I would know if that medication was actually helpful or not? I think people sometimes are easy to just doubt themselves or doubt what they know or throw away what they know because somebody else says they're an expert, and I don't think it's necessary. So that's my controversial opinion at the detriment to all of my fellow healthcare providers. This is not a replacement for healthcare information, absolutely not, but it is a highlight that most people don't have any dementia care training, don't have dementia care specialty. There is a big gap, and there's a lot of people who are taking advantage of this and saying now that they help people with dementia or they help caregivers who have dementia because maybe they had a grandma who had dementia, or maybe because they took a weekend class and got a fancy certificate, and I just don't think that's enough. So ask questions, follow up, ask them why they're recommending what they're recommending, ask them for the research on it. It's okay. And I just want to apologize that you are even in the position where you would have to do that. Like, you're already having to do so much as you care for somebody with dementia. The fact that you would even have to have that kind of filter on, I do think it's a shame. But I think when there are 6 million adults in the United States, older adults in the United States with dementia, and there are only 250 of people who have my background and only 7,600 people who are board certified geriatricians, I think the majority of people who are trying to help, they can still be helpful. Don't get me wrong, they might still have some really great value and can be of help. However, some of them might not. And it is okay for you to advocate for your loved one. Nobody will advocate for your loved one better than you. Okay, Careblazer, how do you feel about this video? I would really love to know. So this is the end video of April. I promise we'll move on to something better in May. So April was about controversial topics and unpopular opinions. That's what we were doing here this month. Next month, let's liven things up, make things better, make things brighter. And I'm going to be sharing the top caregiving success secrets that many caregivers have. The things successful Careblazers are doing. The things that Careblazers who have the most success in behavior change and reducing stress and building great relationships. What are those Careblazers doing? I want to share some of the top tips with you for the month of May. Let's brighten things up around here. But the whole purpose of the April series was I do not want to shy away from the hard topics that I think are important for other caregivers to know. I am open to your feedback and what you have to say. You can leave comments below. We do read them. We do follow up on them. We take lots of our video ideas from them. If you have an idea for a monthly theme, you can let us know. And I'm sending you so much love, Careblazer. All right, bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free. And Nico says, thank you very much.